A 8-year-old girl has pain and tingling in her left hand when she goes backpacking. The symptoms resolve 5 minutes after she takes off her backpack. Which of the following abnormalities is the most likely cause? Now, in this picture, I have an image of the scaling triangle. Scaling triangle is basically going to be this triangle that is going to be found above the clavicle. So the clavicle is going to make the base of the triangle, and then we're going to have the middle and the interior scaling making rest of the triangle. Now, the most important thing to know is that the brachial plexus is going to be coming through this triangle. So in yellow, I have the brachial plexus, and the brachial plexus is going to be coming through this triangle. Now, most people are not going to have a cervical rib. A cervical rib is going to be this rare anatomical anomaly that can occur in some cases. Imagine that this green thing that I'm drawing right now is a cervical rib. So if someone has a cervical rib, then this cervical rib can actually compress and inflame the brachial plexus, resulting in symptoms of pain and tingling. Now, this patient is experiencing those symptoms when she puts on a backpack. So imagine if you put on a backpack and then there's this downward pressure that is coming. And so this downward pressure can then compress the brachial plexus with the cervical rib, and so that can ultimately cause symptoms of pain and tingling. And so that is what the patient is experiencing, and when she takes off the backpack, the symptoms resolve. So to answer the question, the anatomical anomaly that is most likely going to be causing her symptoms is going to be answer choice B, cervical rib.